Ugandans we tayari.
The World AIDS Day celebrations kicked off this morning in Rukunjiri district, an event that was attended by President Yoweri Museveni and several other dignitaries.
All in all, the people so perished. So, the echoes redeem, widows, widowers and orphans.
The celebrations today come at a time when Uganda currently has over 1 million people living with HIV/AIDS, with the majority of them on anti-retroviral drugs, commonly known as ARVs. In his speech, President Museveni urged the people living with HIV/AIDS to take their medication to live longer, since the government has gone out of its way to make the drugs readily available.
Get tested, get treatment, and stick to the treatment. If you are on these drugs, please stick to them so that you don't relapse.
With the global goal of kicking out HIV/AIDS by the year 2030, President Museveni has urged people to change their way of life to avoid contracting the deadly virus.
The main source of AIDS now appears to be behavior related, where you do what you shouldn't do and then you get AIDS. So therefore, I really am determined to insist on this behavior change. And you, the church people, the mosque people, please bring this one out very clearly. And the other disease, because we don't want to cut on the potential of our children by this problem.
According to the Ministry of Health, the biggest number of HIV infections are found in the urban areas, while the majority of people living with the virus are of the female gender. According to the State Minister for Health in charge of general duties, Handifa Kawoya, government is fighting hard to see to it that the number of infections among people are reduced.
We have put in place a number of programs, all intended to educate the public, to ensure that we disseminate information to the public about HIV/AIDS prevention, care and treatment. We have put in place many flexible management and treatment which are all intended for service delivery to our people.
In December 2020, UNAIDS released a new set of ambitious targets calling for 95% of all people living with HIV to know their HIV status, 95% of all people with diagnosed HIV infection to receive sustained anti-retroviral therapy, and 95% of all people receiving anti-retroviral therapy to have virus suppression by 2025. Uganda says it will continue following that target.